the distal buccal of the tuberosity. Suturing on the right side is done exactly the same way as it's done on the left side, so we're not going to show you this procedure to save some time, but here's the final tie on the right side, and that completes our suturing. Here's a shot of the completed suturing. You can see that the flaps are snug around the implant heads. The patient's denture is hollow ground and a soft treatment liner is placed into the denture. The denture liner is tissue molded in the patient's mouth. Excess material is trimmed outside the mouth. This represents the patient after healing for 4 weeks. You can see the tissue is nice and pink and healthy, and the patient is doing very, very well. This case is now ready to start to restore. Make sure the heads are trimmed to between 2.5 to 3.5 millimeters. In this case, the heads came out to the point where we don't have to trim them, so we're going to take an impression and start the restorative procedure. The retention bar system. A period of 3 to 6 weeks is allowed for complete healing of the tissue. A resilient gasket, parallel guiding planes bar is then constructed and cemented onto the implant abutments. Dual hydrocolloid final impressions of the bar and anatomy are taken and poured in the laboratory stone. Here are the master casts. Wax up setup. Here's the wax try-in in the mouth. Check midline, smile line, buccal corridor, high, smile line, and lip support. A silicone gasket is processed into the underside of the implant retained overdenture. Okay, let me show them your teeth there. Big smile. And then this comes out. And then he has a bar. And then snaps back in. Very easy to clean. Now this pear is not all that ripe, so it's like an apple. Let's see what you can do with that. It's kind of tough, huh? Could you have done this with your denture?
Heck no. I would have had to take a knife and cut it and stick it in my mouth.
Okay. Try that again and see if that's better than your denture.
Well, it's a lot better than denture. I know that already. The denture, if I took like that, and the denture would have come out and walk around my mouth.
Right. So you can get a really good power into that without it coming out.
Yeah.
On a scale of 1 to 10, how does this compare to a denture?
11.
11? Okay. Well, thank you very much.
To eat them? This is my first apple in over a year. Here goes.
Good.
Mm-hmm.
Just like good.
Take another bite.
Mm. Feels weird to be able to chew. Thank you. This is awesome.
This is Dee Doe, and she's had a maxillary subperiosteal implant since 1993, and we're getting to deliver today her third set of teeth since 1993, and we're going to slide those in right now. These are with the hater clips. You can hear a little click of them snapping in. And it'll be a big smile. Okay, here's a Maxillary Custom Endosteal Implant that's been in for about 9 years or a little more. And you can see the tissue around that implant looks perfectly normal, nice and pink. Patient's done extremely well with this implant long term. Tell me about your experience with your implants.
The experience has been wonderful. Prior to having implants, I had dentures, and I couldn't bite into apples. I certainly couldn't chew gum. I do a lot of public speaking, and I was always worried that my denture was going to drop. Since I've had the dentures put in, I smile a lot more. I feel it in your mouth, and your teeth are kind of your window to the world. And if you feel that you look good and you smile a lot, it affects your whole life. So I have really enjoyed the appearance of the teeth. I have very few people that have ever, noticed that my teeth weren't my own, and I've been extremely happy with them.
Thank you for watching our video. I hope you enjoyed it as much as we enjoyed putting it together. This now concludes our presentation.